Welcome to Connective Care Education. Today we are going to look at Unit 001, Principles and Values of Health and Social Care, Adults. Unit 001, Outcome 6, Understanding how to develop positive relationships with individuals, their families and carers in the context of professional boundaries. Let's start by looking at relationship-centred working. Relationship-centred working introduction. Best practice in any work setting is underpinned by effective working relationships, an ability to follow agreed ways of working, and an ability to work in partnership with others. Effective work relationships. In health and social care settings, effective work relationships are based on professionalism and principles of care, which require health and social care workers to respect and promote the rights of everyone they work with. Relationship-centred working is a personalised partnership approach of forming and maintaining important relationships, as well as recognising the importance of these relationships in delivering effective and safe care and support. This includes team members, colleagues, other professionals, the individuals who need care and support, and everyone who is important to them. Their families, friends and advocates, for example, are further supported by relationship-centred working. The relationship-centred approach recognises the importance of the interpersonal and intrapersonal relationships that exist between the individual and others around them. The relationship forms the context within which care and support takes place. Please pause the video here and complete worksheet Learning Outcome 6, Worksheet 1, Effective Work Relationships. Now we can look at the importance of developing a positive relationship with individuals, their families and carers. The importance of developing positive relationships. Providing real choice and control for individuals accessing health and social care means enabling individuals to take the risks they choose. Everyone has the right to take risks and make choices, but if an individual has a more limited understanding of the risks involved in an activity they wish to participate in, they must be supported to make informed decisions. When we look at risks, we should do so in relation to individuals' strengths, abilities and support networks. Everyone should have the right to make choices about their lives, so it is important to work out whether a risk is significant and whether it is likely to happen. Health and social care settings must be able to demonstrate that a risk assessing process, a process of thinking things through properly, involving the individuals and others who know them, has taken place. This may or may not result in a formal written risk assessment. Professional boundaries and how to balance these with relationship-centred working. Professional boundaries. Relationships are probably the most complicated area of our lives. We start to form relationships when we're born. Effective work relationships are based on professional boundaries, which means that when carers support individuals with health and care needs, they must show respect for their beliefs, opinions, life experiences and social, cultural and ethnic backgrounds, deliver services based around their wishes, expectations and preferences, support their rights to dignity, choice, privacy, independence, confidentiality, equality and fair treatment, protect them from harm while supporting their right to take risks, communicate using the individual's preferred method, support them in such a way that meets their specific needs. And remember, they are professionals, not friends, so must act in a professional manner at all times. Balancing these boundaries with the need for relationship-centred working is important in order to achieve effective service delivery. If an individual does not feel valued and included, they will not be willing to express their needs, wishes and concerns. Types of unacceptable practices that may occur within relationships. What are unacceptable practices? Good practice in health and social care involves staff working in a way that puts the needs of individuals they are supporting first so that they receive dignified and safe care. Unacceptable practice involves the individual not receiving appropriate care and treatment and that they feel they are being failed by the system. Another example of unacceptable practice is when individuals are put at risk and denied services that they are entitled to, being unfairly treated and or discriminated against, and not supported to meet their needs. It could involve taking advantage of individuals for financial gain or asking them to undertake duties that they are not trained to do so. Examples of unacceptable practice: sexual contact with an individual using the service, causing physical harm or injury to individuals, making aggressive or insulting comments, gestures or suggestions, seeking information on personal history whether it is necessary nor relevant, watching an individual undress where it is unnecessary, sharing own private or intimate information where it is necessary, inappropriate touching, hugging and caressing, concealing information about individuals from colleagues, for example, not completing records, colluding with criminal acts, acceptance of gifts and hospitality in return for better treatment, spreading rumours or hearsay about an individual or others close to them, misusing an individual's money or property, encouraging individuals to become dependent or reliant for the worker's own gain, giving special privileges for favourite individuals, for example, spending excessive time with someone, becoming over-involved, or using influence to benefit one individual more so than others, providing forms of care that will not achieve the planned outcome, providing special advice or counselling where the worker is not qualified to do this, failing to provide agreed care and support, or for rejecting an individual, for example, due to negative feeling about an individual, trying to impose own religious, moral or political beliefs on an individual, failing to promote dignity and respect, and any practices specifically prohibited in relevant legislation, statutory regulations, standards and guidance. And finally, please pause the video here and complete worksheet Learning Outcome 6, Worksheet 2, Examples of Acceptable Practices.